over the last few years, there's been a lot of interest in trying to interrupt the crosstalk between CD47, which is a do not eat me signal, can be overexpressed on the surface of B-cell lymphomas, and SIRPα, which is the receptor for CD47 expressed on tumor-associated macrophages. There are multiple clinical trials that have utilized anti-CD47 antibodies. Magrolimab is probably the most known in the field. But even if there's some good efficacy signal, particularly in patients with indolent B-cell lymphoma, there's some concern in terms of safety. The issue being that CD47 can also be overexpressed on red blood cells, and its use can result in higher myelosuppression, particularly anemia. Hence, the development of agents that instead of targeting CD47 target SIRPα, which is only expressed on myeloid cells and very specifically on macrophages. The additional advantage of targeting SIRPα is not only to have potentially a better safety profile, but also potentially better efficacy, because by targeting SIRPα as compared to CD47, there would be less sink effect, and so less agent will be washed out by CD47, and this could translate into higher anti-tumoral activity. To this regard, CC-95251 is a novel first-in-class antibody targeting SIRPα. We were able to investigate the safety and efficacy in this first-in-human phase 1 study, where more than 17 patients were enrolled during the escalation phase, and we presented the escalation phase data this year at the European Hematology Association meeting. There were DLT events. As expected, they both were represented by neutropenia, and this is because SIRPα, in addition to being expressed on tumor-associated macrophages, can also be expressed on neutrophils. They both were grade 4 neutropenia events, but well manageable through use of GCSF, and did not result into any toxicity-related deaths. Despite these two DLT events, we were able to safely complete the escalation phase, and no maximum tolerated dose was identified, though currently we are expanding the trial. We are at the recommended phase 2 dose of 20 milligram per kilo weekly, and we hope to complete the expansion phase in the near future. Beyond showing this very promising safety profile with not a single event of is the main concern with the use of anti-CD47 agents, and toxicity by neutropenia, low-grade thrombocytopenia, and about 30% infectious events. Efficacy data were also very impressive. In a heavily pretreated and heavily refractory B-cell lymphoma population, including mostly patients with aggressive B-cell lymphoma, the complete response rate was 25%, independently from the dose level and independently from the histology subtype. This is very promising, and in light of its safety profile, also favors combination of CC-95251, not only with Rituximab, which is the antibody that was used in this trial, but also potentially other agents such as immunotherapy. And so hopefully the safety and efficacy data from this trial will further support the clinical development of this agent for patients with B-cell lymphoma. Most importantly, our group at MD Anderson has demonstrated the overexpression of SIRPα positive tumor-associated macrophages can be the mechanism of resistance to immunotherapy in patients with indolent B-cell lymphoma. So targeting SIRPα for patients with follicular lymphoma who relapse after frontline R-square may be very effective, and we already see an interesting efficacy in this trial. So we look forward to the further development of this concept in the next few years.